Thanks so much for joining us today. Seeing folks start to filter in here. We are so excited to dive into the topic of integrated outbound fax today. We're going to explore how this feature can streamline your workflow. Before we begin, let's just quickly go over how we'll interact during the session. So if you'd like to engage, share your thoughts, feel free to use the chat feature. And then for any specific questions, please do use the Q&A option. We'll have some time to go through questions asked at the end of the presentation as well. And then don't worry too much about taking detailed notes. We've got you covered. A recording of today's session will be sent to you via email and also shared on YouTube. So you'll have full access to all of the information later on. And then in the meantime, we'd love to know who's with us today. So please do take a moment to introduce yourself in the chat, maybe sharing your name and where you're joining from. Again, thank you so much for being here. Let's just get started with some personal introductions. So my name is Maddie, and I'm a product manager here at Jane. Nice to see you all. I work to define the product vision for my area of Jane, prioritize features, and coordinate with my team directly to develop, launch, and optimize a product that meets your needs as the customer. You might run into me, or maybe you have run into me in the past in the Facebook community or in Canny, reaching out to you to collect feedback. I always love to connect. I'll pass it over to my co-host, Dennis, to introduce himself as well.
Hey, everybody. My name's Denis Whelan. I'm CEO here at Documo. And yeah, super excited to meet some of the Jane customers on the webinar, and even more excited about the partnership that we're going to be able to talk about. Just a quick background on me. I live in Boston, Massachusetts, or just north of Boston, Massachusetts, in a town called Marblehead. And Documo is a remote business, so we're located all over the world, and yeah, looking forward to digging in more here.
Awesome. Thanks, Dennis. Okay, let's get into it. Integrated outbound fax. So this is the agenda for today's session. First, we're going to start with an introduction to the feature, integrated outbound fax. And we're going to talk about why online faxing from Jane is so valuable. And then we'll dive into how it all works with a quick overview. Following that, we're going to hear from Dennis, who will guide us through getting set up on the Documo platform, what that looks like. He'll provide an introduction to Documo, explain pricing, and walk us through what's included. And then last but not least, we're going to move on to sending your first fax from Jane. So we'll cover how to connect your integration, and I'm going to show you a step-by-step live demo so you can really see the full process from start to finish in action. And then finally, we will wrap up with Q&A, where we'll answer any questions that you have. Okay, so why did we build integrated outbound fax? Well, many of you have experienced the frustrations with non-integrated faxing. It often involves, that cumbersome process of downloading, uploading, even printing documents to send them out. This not only takes a lot of clicks, but it also increases the chances of documents getting lost or forgotten. Some of the main problems that myself and my team were hearing when we were really talking to you, the customer, about this was we were just hearing that the time it takes to send a fax is too long. There was just risk around doing everything outside of Jane. And plus, it's just really an administrative burden. So the solution that we came up with was integrated outbound fax. And this feature allows you to securely and reliably send documentation directly from your patient's charts. This means fewer steps, less risk of mislaid documents, and truly just a much more delightful experience. And then a fun fact, as I mentioned, this feature originated from your requests and other feedback from our community. We knew that the way that you were currently managing this outside of Jane just wasn't really cutting it. And so we wanted to solve this problem for you all. This is just a quick demo, and we'll go into more later, but this is how you will send a fax from a patient's chart directly from Jane. So you can see it's as easy as clicking just a few buttons to send it off. And then I should add that when a user has previously and successfully sent a fax to a specific contact, Jane's now going to remember that contact for future use, really just directly reducing the time it takes for you to enter that information manually. So first you saw a singular chart entry being sent. Now we're seeing a batch group of charts in just a few clicks, But again, I'm going to go over this all in more detail near the end of this presentation. All right, just going to pause that and flip to the next slide here. Okay, so integrated outbound fax is included in all Jane plans for users in the US and Canada. You will need to sign up for a Documo account through your Jane account first to gain access. Dennis is going to go over their pricing in just a few moments, and you can also reach out to them anytime for more information. And just a little bit on the why that we've partnered with Documo and why we chose to integrate with them. It's because their values really line up with what our customers tell us that they love about using Jane. So HIPAA, PIPEDA, and GDPR compliant, Documo has high uptime. They're cloud-based and available on any device, just like Jane. They're well-designed, easy to navigate, and most importantly, they're customer-focused with real-time and self-serve support. You don't have to take my word for it, though. I'm going to pass it over to Dennis. Dennis, I'm hoping you can tell us a little bit more about how Documo works.
Yeah, hey everybody. And again, excited to show everybody a little bit about who we are. And Maddie's going to go through a little bit of a demo connecting Jane and Documo together. But Documo is a cloud faxing platform. And the reason why we built it in the first place was a few reasons. The first is, traditional fax tends to be quite unreliable. Even cloud fax providers today have unreliable services. They tend to be really difficult to use, and support is really difficult to come by. And so Documo has kind of taken a little bit of a juxtaposition relative to the market in making our platform really, really easy to use and well-designed, beautiful user experience, reliable, but also at the same time, customer support that's going to jump on the phone with you and chat anytime you need. And so it's a little bit of a different approach than what folks have seen in the U.S. market and Canadian market as it relates to cloud fax. And we tend to approach things a little bit differently. And so Jane and Documo together made a lot of sense. If you want to move to the next slide. So interestingly, I don't think anybody got into the practice or provider situation that they're in, thinking that they'd be solving compliant communications through fax, which was a technology that was built in 1842. And so, the unfortunate thing is fax is here to stay due to kind of the compliance nature that exists in healthcare. And that compliance really dictates kind of us solving a problem that we wish we never had in the first place. And so that doesn't mean that we have to have a situation where it's difficult to actually communicate. And so our focus as a business has been not just solving for compliant and easy transmission of documents, of healthcare documents, but also at the same time, making sure that we can understand and unlock downstream workflows. And so while we do have a connection with Jane directly from the charts and bulk sending, as Maddie had mentioned, Documo is a fully fledged cloud fax enterprise grade piece of technology that has everything from address book, inbound fax, outbound fax that you're able to access through Jane, and a variety of other features that are accessed directly inside of our platform that you get access to with your plans. So if you want to move to the next slide, Maddie. And so, again, this is the Documo platform is the fastest growing cloud fax platform in the market. It's something we're really, really proud of. And it's because we really take care of our customers. Beyond that, we care about making sure that our features are fully fleshed out and built out for our customers. But more so, we think about the problems that exist inside of the healthcare space is not just when a document is delivered. So not just about the pipes, but also the payload, like what needs to happen with that document once it arrives. What are the other downstream things that we need to be able to do there? And we love our customers and our customers love us. And so I'll give you a little bit of sense of what the plan looks like here. Credit to the Jane team on this for negotiating and building a relationship on behalf of their customers, and hopefully soon to be some of our customers. An amazing plan that you can just go to our website to look at what our normal plans are and the typical price per page. But this is an incredible price per page, but also a monthly rate that only Jane partners get. And so it's an opportunity to be able to dig in. I will say also there's a free trial that anybody can go in and activate inside of Jane. There is a limit currently in the trial of 100 pages, but it'll certainly give you a sense of how it works and how it operates. Yeah, looking forward for people to test that out a bit. So. And then you can actually access this. You're welcome to scan the QR code and activate your free trial to dig in. You certainly don't have to activate the full plan, but go give it a try and a spin in between, sending faxes from Jane, but also logging into Documo. The thing I'll say is, while Outbound Fax exists in Jane, like we talked about before, Maddie's going to show you all the features or some of the features that exist in Documo that are well beyond, some of the elements that we've snapped into Jane through the integration and partnership. And so if you're looking for address book, if you're looking for fax history, if you're looking for more complicated in-depth features, those all exist inside of our platform. Yeah, looking forward to everybody exploring that a little bit. So with that, I'm going to pass it back to Maddie so everybody can see a little bit more live.
Awesome. Thanks, Dennis, for sharing a little bit more about Documo and the history behind Fax. Okay, so now this is the exciting part. We get to see the feature live. Getting set up is super easy and it only takes a few minutes, which I'll be able to show you here. So I'm going to walk you through a demo of the whole process from sign up to sending your first fax. So first and foremost, you are going to need to sign up for a Documo license from within your Jane account via the settings and integrations area. And this is really important because this is how, aside from that QR code you just saw, this is how you're going to receive that special Jane pricing that is for Jane customers only. And so to get started with Documo here, you're going to jump into the settings area of your account and you're going to jump over to integrations. And then if we just scroll down a little bit, you're going to see a section for Documo where you can go ahead and click to get started. And you're going to see this lovely page here. You can learn a little bit more about the fax integration, but most importantly, this call to action here, this sign up for Documo is going to be how you receive that special pricing. So once you click that sign up button, you're going to proceed to this page here where you're going to enter a few details, first name, last name, email, followed by password. And then you will receive an email to your email inbox so you can then activate your Documo account. So I'm not going to show you that specific step, but once you activate your Documo account, you'll be able to sign into the Documo portal, which you'll see here. So now that you have access to Documo, essentially what you're going to do is you're going to connect your Jane account to Documo. And so to do that, you're going to pop down to API keys on the left-hand side, and you're going to go ahead and create an API key. So for today, I'm just going to name it demo test. We're going to pop the access level to admin. We're going to leave this expires at date, and we're going to create this special API key. And then once we do that, we want to make sure that we keep this API key safe because we're not going to be able to see it again. So I'm going to go right ahead and copy it now, followed by I saved it. I'm going to pop back into Jane and I'm going to just paste that API key right into step 2. And then I'm going to click connect. And then once you click connect, your Documo integration is set up and you're ready to send your first fax. So to send that first fax from the patient profile, you're going to head over to patients. And then I'm going to select Chloe here, followed by charts. And there's a couple of different ways that you can send faxes from this area. So we're going to go through all 3. So in order to send a singular chart entry, you're just going to go to the right of the chart here, select the arrow, followed by fax. Alternatively, you are fully able to select multiple charts within a specific date range. So to do that, you're just going to jump up to filter export. You're going to go to date range here, and you can just choose whichever date range you'd like to send. So maybe I'd like to do last month, for example. So all of the charts for last month for Chloe, we can fax by now selecting the 3 dots, followed by fax. And then last but not least, you can also send a full treatment plan. And so you'll see my spinal alignment program here. To send this treatment plan, I would select actions, followed by fax. For this example though, I'm just going to send a single chart entry from Jane. So let's pop down to this chart entry here, followed by fax. This is the fax panel. So you'll want to send a recipient name. And so as you'll see here, I've previously successfully sent a fax to test office. And so Jane's actually just going to autofill that and remember that for me immediately once I start typing in the information. So this should reduce some administrative time with entering the recipient name and fax number for you here. And then if you'd like to include a cover page, you'll want to make sure that this is toggled on. The cover page template that's set as your account default in Documo is automatically going to be applied as the default cover page for your documents. The default cover page does give you the option here. You can add a unique subject and a unique set of notes for each fax that you sent. And this is really just to ensure that the cover page is meeting your needs every time you'd like to send a fax. So for example, in the notes section, you might want your inbound fax that you're expecting to receive to go to a different number than the outbound number that you sent from. You could add that to the notes here. And then once you're ready, you'll scroll down to the bottom and you'll click send. You're going to see an in progress status bar up at the top in Jane in this panel. And then once it's successfully sent, this is going to turn to green. However, you don't necessarily need to sit here and wait for that to change. You can actually jump on over into Documo to see a detailed fax history. So we're going to pop back over here. And I'm going to go to this little logo here, followed by history. And we're going to see that the fax that I just sent is already successfully gone through. So you'll see this green check mark here. And if you'd like to see this in more detail, you can go ahead and click this checkbox, followed by view and print. And then you'll see a sample of the fax that was sent. So you can see we sent it to test office. You'll be able to see the subject line and the notes that I added. And then if I scroll down, you'll be able to see all the details of that fax that was sent. So I'm just going to exit out of here. And then as well, in this specific area, you're welcome to click on the three dots next to a specific fax. So for this one here, I actually see that this fax had failed. So I want to investigate that a little bit more. And so I'm going to jump in here, click on these three dots, and I'm going to go ahead and select info. So we can see that the status was failed. We can see the result code here, and then we can actually see why. So we see that this one didn't do so hot because the fax number was busy. And so that's really important information for us to understand. And we can simply just go ahead in the Document portal here, and we can actually just resend that fax. So you can kind of manage your faxes in this area if you do need to resend anything, and you can ensure that you're viewing that full history inside the platform here. As well, I should mention that this is where you have the opportunity to also receive inbound faxes. So although in Jane, you're only able to send outbound faxes, within the Document portal, you're certainly able to receive the inbound faxes, and you'll receive them here. And so you can see that I don't have any inbound faxes right now, but if I did, you'd see them here. And then we can just go back to see everything. Okay, so that was a demo of how faxes are sent from Jane. There's a couple other areas in the Documo portal here that I can just point out to you, as Dennis mentioned. And so cover pages is probably one of those areas that you'd like to see. So there's a number of defaults that are available to you within the Documo platform. You can also make your own cover page, but these details, or excuse me, these default templates are set up really nicely for you to use. And so to set a default, you're able to actually just do so right here. And you can preview, you can adjust the default templates that are here, and you can really go through and just find one that suits your needs. I know that Documo does have very helpful guides and videos on setting these up as well. And I know that their team is available to support you should you need help with setting up these cover pages. As I mentioned, the one that you're setting as your user default is the one that Jane's going to use automatically for your faxes. And then as well, you have the ability to view your numbers and manage your numbers. So they do have this full address book available in Jane, or excuse me, in Documo for you to use. So you can import your contacts in here and have them stored and available for use. Okay, So that's a kind of a comprehensive demo of everything that we wanted to show you about the fax feature, how you can fax from Jane, how you set up that integration, and what you may use most inside the Documo portal here. I'm going to jump back over to our slide deck, and then we should have an opportunity here to go through a couple of questions. Before we do get into specific questions, though, I wanted to just chat through a few extra tips which may answer some of the questions that you're asking. So let's just start with the fact that you now know that in Jane, you can send a fax from a chart specifically. However, I just want to emphasize that in Documo, you can send other outbound faxes and receive inbound faxes. So any pages that you do send or receive do count towards your monthly total, so just keep that in mind. Second, a very common question, porting your number is most certainly available. So if you do have another number or fax provider and you do want to make the switch, Documo can definitely help you out with that. We'll send a link in the chat so that you can learn more about porting if you need it. Thirdly, Documo does have an address book, which I showed you briefly. So you can save all of your contacts in there if you need to. You can import those in from another service. And just as a reminder, if you have successfully faxed to a recipient through Jane in the past, Jane will remember that contact number for you next time you start typing the name when sending a fax, reducing that administrative load. And then as a reminder, Documo does have a ton of guides available to help. So my recommendation is to start there if you do have any questions that we don't have time for today. I'm just going to pop over to view some of the questions and we can start going through those. All right. Can you pre-enter fax addresses? So yes, again, that's happening via the fax panel. And so you are certainly able to and start entering that recipient name, and then Jane will remember that for you if you've previously and successfully sent a fax. I'm just going to pull up my questions here. Okay, looking to hear about how insurance companies can fax you authorizations or requests. So yeah, so that'll happen in the Documo portal and you'll be able to receive all of your inbound faxes there. Again, I'm also interested in receiving faxes and if Jane Documo can support this, of course. So that's again, just in this area here in the Documo portal, you'll be able to receive inbound faxes. And then is the trial 100 pages? And is the time frame limited or once you reach the 100 pages? That's a great question. So the Documo trial that the Documo team has made available to Jane users is that you have 14 days on the trial and or you have faxed 100 pages. So kind of whichever of those limits you reach first. Those 14 days and those 100 pages should give you a really good chance to just get comfortable with the feature and try things out. If we get access to Documo, does that mean we can have full access to send faxes not related to Jane? 100%. So if you have other outbound faxes that you do need to send from Documo, you can certainly do so here. Doesn't need to be related to Jane. You'd be able to manage those and send those directly from within your Documo portal. Does Jane have a training demo that we can share with staff? Yeah, most certainly. I wonder if we could even just pop some of those into the chat, Jane team. We could share our guide in there, which has the specific video that will give a rundown and overview of the feature. I'm sure the Jane team is probably already on that. Okay. Will you be able to block spam faxes? Oh, that's a really good question. Dennis, I'm not sure if you'd be able to jump in on that one for us.
Yeah, absolutely. You can certainly block numbers within our platform that are sending spam over. Sometimes we see that for people that are doing blasts for menus and stuff like that to providers. So you certainly can block those numbers.
Perfect. Thank you very much. Okay, next question is, oh, this is a good one. So who is a user? We have dozens of providers and therapists in one Jane account. So let me just get into this a little bit more because this is a bit of a longer answer. So the Documo plan for Jane customers includes 3 fax numbers and 3 users. And so essentially, we do recommend that you would create separate users in Documo for each staff member who will be logging into the Documo portal outside of Jane. That way people aren't sharing one singular login. Plus, each of those users in Documo can subscribe to the fax numbers that they'd like to receive notifications for via email. However, you do not need to log into the Documo portal to send a fax, only to view inbound faxes and see that history and manage things on the Documo side. So if you have multiple providers in Jane who do need the ability to send faxes, as long as they have access to the charts area of Jane, then they can most certainly send faxes. And there's no limited amount of people in a Jane account that can send faxes. Hope that answers the question there. I am wondering if there is the ability to mark up the documents that we're faxing. The VA requires the ID number at the top of every page that is faxed. So I'm thinking that we could either have a customized cover page with that information, or you could enter that information maybe into the subject or notes field, because that can be customized for each fax. Hopefully that answers your question there. Just going down the list. Can you transfer over an existing number? Yes, most definitely. You can put in a porting request to Documo. Would I be able to fax invoices? So this is actually probably a very common question that we should go over, and I'm going to jump into Jane here to go over this one. So if you need to fax documents that are outside of the chart area of Jane, you can do that by adding the file to the chart. And so what that looks like is I'm in the patient's profile here. I'm going to jump over to files, and I'm just going to upload a file that I have. I just have a random screenshot of the Jane schedule here. So here we are adding the file to Jane. I'm going to include this in the patient's chart, followed by save. And if I pop back over to charts, I'm going to see that file, which I can then fax directly from Jane following the same steps. Can we add our logo to the fax cover page template? Definitely. Yeah, Documo's cover pages are extremely customizable, and you should be able to add a logo into there. Can you import an address book so we don't have to start from scratch and re-enter numbers from our current platform? Yeah, most definitely. You can import your address book into Documo. However, the contacts that you have in your address book are not going to automatically pull into Jane at this time. However, what I did mention before was that once you've specifically sent a fax to a contact, then Jane will remember that for you. And so that's that functionality again, which you've just seen me demo there. Does each Jane user need an individual Documo account? Hopefully I answered this previously. You do not need an individual Documo user account in order to send a fax from Jane, just to view that detailed history and receive inbound faxes. Is our use of inbound into Documo included in the $15 a month rate? It most certainly is. So that $15 a month pricing provided by Documo does include inbound and outbound faxes. If we don't port our fax number, what number is used? Great question. So I believe Documo will just assign you a new default fax number. Is that right, Dennis?
Yes. Yep. We would just assign you a new default fax number. And there's actually a little bit of an add-on question to that. If you have 3 users and 3 numbers, are those users tied to those numbers? And the answer to that is users and numbers. Users are unique individuals logging into Documo, directly into Documo, not through Jane, like you just answered a second ago. And then numbers can be assigned to all of those users or none of those users. And then you can also add as many numbers as you want. So if you have 4 locations, you could have 4 numbers, 1 for each location. All 3 users may have access to each of those locations, if that makes sense. And so you just get charged a little bit more for that one extra number on top of the other three.
Perfect. Thank you. Does this deal expire with Documo? Let's say we paid annually for our other platform and it expires in December. Could we sign up in December for this same rate? Definitely, you can sign up for this rate in December. Okay, just jumping down here. Is the fax log history kept indefinitely? In the event we need to go back and reference when something was faxed in the past, and if an insurer adjuster said they didn't get a report. I don't believe the fax history goes anywhere. Dennis, maybe you could just confirm if that history is kept indefinitely.
Yeah, that history is kept indefinitely, and our data retention policies align to both HIPAA and PIPEDA, so we maintain that history. If you cancel with us, we do also have data retention policies where we do get rid of that data over a period of time. I forget the actual number of months that are required by HIPAA for us to and PIPEDA to be able to retain that, but we adhere directly to those standards to maintain our strict compliance.
Perfect. Can you show us how to make the cover page again? Yes, definitely. I can show you the cover page. So if we jump back into the cover pages area in the Document portal here, you'll be able to view these default templates. So for example, maybe I'm just going to view this simple one, and then I can essentially actually just jump in and edit this one. So you can kind of see what it looks like, or I'm previewing it now. And you are able to edit all of these details specifically. Let's go here. Let's set this one as the account default. And let's jump in, and I believe, team, remind me the edit button. I'm just looking for that here. Dennis, remind me where I can
Oh,
edit these templates.
Yeah, I think if you go into the create new,
Create
there you
new, there it is. Thank you for the reminder. Perfect and done. So we can jump in and we can essentially edit these. And so yeah, you can see how customizable these are. Again, Documo has really great videos and guides that can help you with this. And I know that their support team can always help you set these up if you need to, but you can see how customizable these fields are. There's a number of different tokens available to you here. So you'd be able to really just customize whatever you need to have in here. And you can add your logo, things like that, as we mentioned before.
Maddie, one other thing on customization for a question that did come up is if they could request their own area code or their region for their fax number. And if you want to navigate to numbers, just to show everybody, just click on numbers
For sure.
and then do provisioning. This is a way right below numbers. But this is a way to provision your new
Perfect.
numbers. And this is where you can select your region, add your area code that you want to be able to find those numbers. So this is the provisioning of brand new numbers that you want. Porting, which is right below that, is bringing over numbers from another account or a physical fax machine. And then block numbers are the spam calls that we talked about earlier.
Perfect. Thanks for that. And then as well, while we're here, we might as well just look at the porting tab as well. So you can input a new porting request here if you do want to or need to port your existing fax number. Can Documo accounts be transferred to new employees if someone is no longer with the company? That might be a question for you, Dennis, there around transferring ownership of a Documo account.
Absolutely. Absolutely. Yeah. So on the left-hand nav here, you can see the users button. That's where you're going to provision and manage users across an admin account. And you can absolutely change somebody's username and password and email to be able to reassign to somebody else.
Perfect. Can our current fax number be used in Documo and in our clinic, or do they need to be separate numbers? I'm wondering if that's referring to a physical fax machine in clinic. I believe the same numbers could potentially be used. Dennis, I might defer to you for that one as well.
Yeah, so there's a little bit more of a complicated thing with fax machines. Sorry, the numbers are easy to port over, so you can port over any number that exists. And just so everybody knows, it's a legal right of any customer, just like your phone number. You have a legal right to take that number with you, and transfer it to whatever service you want. So you have the ability to transfer those numbers at any point in time. We handle that request with the telecommunication provider on the back end. So there's a bit of us going to them saying that you need to pass that number over to us, and they have a period of time that they have to respond back. And as it relates to physical fax machines, it also depends on if you want to keep the physical fax machine as well. Documo has something called a fax machine connector, an FMC, that if you wanted to keep your fax machine, which I'm not sure if that's really what you would want to do, you could do everything directly in the cloud here. But we have these little boxes that you can snap onto the fax machines to be able to push everything into the cloud, both sending and receiving.
Awesome. Thanks for that context, Dennis. That's helpful. Another great question here. Can you fax over outcome measures, surveys, billing, medical release? So anything outside of the Jane chart area, which I demoed a little bit before. Excuse me. So you can only fax directly from the charts area in Jane. However, if you have any files, you can add those to a chart entry and fax them from there, which is that example where I uploaded this specific file that I had and added it to a chart entry. However, if you do have other sorts of documents that you do need to fax, billing related, maybe specific insurance forms outside of Jane, then you can most certainly manage that through sending an outbound fax via the Documo portal. So you definitely are not limited to sending those other types of documents. How long does it take to port the number? I believe it's 5 to 7 days is the typical timeline from the document team. But Dennis, correct me if I'm wrong there.
Yeah, 7 to 10 is the typical time. It can take a little bit faster than that. Again, we're going directly to the telecommunication telecommunication provider to be able to get that number. They are legally required to give it to us if you request it. So, but those legacy telecom providers aren't always the most efficient organizations to be able to respond back. But we do get it done.
Perfect. This is a good one. Can you download faxes from Documo and put them into Jane and upload them into Jane? Yes. So you could download something that you received, you could save it and download it, and you could upload it into the files area of Jane. No problem. Let me just see the next question here. Can you show us again how to fax a file from Jane, not in charts, and how to fax a combo of charts and files? Great question. Yeah, so again, let's just run through this one more time because I know this is a common question. So if I'm going to add a file to the patient's profile, I'm going to do so here, and then I'm able to include it in the patient's chart and save. I'm going to pop back over to the charts area of Jane, and you can see that here. So let's say I want to fax this file, and I also want to fax the chart entry from October 18th. So I can actually send batch charts. So I'm just going to select that date range here. So I want to include everything from the 23rd to the 18th. So I have both of the files that I've uploaded, and I actually have 2 chart entries from that day as well. I'm just going to select these dots here, and I'm going to fax those as a batch. And you can see down at the bottom, I'm sending 5 chart entries in this specific fax. All right, I'm just looking to see if there's more questions. Waiting for my team here to put any more in. I'm just going to go through my list to see if there's any common questions that we may not have chatted through yet. I think we've answered a lot of the specific questions. Let's see here. Any other questions that we have, Jane team, that we haven't gone through?
I think the only other one that I saw, Maddie, was if someone has over 500 pages that they typically send on a monthly basis, what should they do? Is there a
Ah,
plan that covers them?
yeah, good question. So I know that the Documo team would love to chat with you more about what that looks like. And so you can certainly reach out to them directly at jane@documo.com to chat about your options. Okay, the questions. Oh, there's a couple more that just came in. Does the chart have to be signed to be faxed, or can drafts be faxed? There shouldn't be a limitation to sending the chart entry, so you're able to send a fax if it's in draft. And there's no way to, the question is, so there's no way to receive inbound faxes, referrals directly into Jane. That's right. So you're not going to receive inbound faxes directly into Jane. So that's going to be managed via the Documo portal. I'll go back to the space here where you're doing that. So the history section of Documo is where you're going to be able to view your outbound fax history from Jane and also receive inbound faxes. And so you can do that directly in this area here. After a chart entry is faxed through Jane, is there anything in the patient profile that will indicate that it has been sent? That's a really good question. So there's nothing specifically right now that indicates that the entry has been sent in Jane. That's going to be managed via your history here in Documo. However, we are exploring of what it could look like to have a chart level history in Jane. And so if you do have feedback on that, or if that would be beneficial to you, we'd love to hear from you on that. Again, this feature, we are still going to be working, we want to improve and listen to the feedback that you have. And so if that's something that would be beneficial, we really want to hear that from you and look forward to exploring more of those options in the future. We use our fax number as a telehealth line too. So can we use the same number in Documo and in clinic, or do we need an additional number? Uh, Dennis, I'm not sure on that one.
Um, let's see. We use our fax number as a telehealth line. Can we use the same number in Document in the clinic? You would likely need an additional number just at a function purpose, as I understand it. I can go double check on that, but my gut is telling me that you'll need another number for that.
Perfect. We can definitely follow up on that too. We can look into that a little bit more and try to find that answer for you there. Another question, after a chart entry is faxed through Jane, is there anything in the patient profile that will indicate that it has been sent? Again, no indication directly in Jane at this time. The history is managed through Documo, but we'd love to hear that feedback from you. If it would be helpful to have a chart level history or patient level history available in Jane. All right, just looking to see if there's anything else coming through here. These are all really good questions, everyone. Thank you for asking. Okay, I think we're slowing down with the question. If there's anything else, I'll give it a few more minutes. If not, I'll just pop back over to the deck here. Dennis, anything else on your end that you're seeing that we haven't gone through?
There is a question about someone that canceled their eFax account, that wondering if they can port the number. I think Catherine asked that. I would drop a note to our support team and just note that to them. If you've already got a porting request in, just make sure that they know what that is. And they may be able to instruct you on the best way to proceed with notifying eFax.
Perfect. All right, I'm just going to jump back to the slide deck here. Oh, one more question. Oh, no, I think we already answered that one. Okay, Perfect. All right, jumping back to the slide deck here and just making sure you can all see this here. So everyone, thanks again for joining us today. At Jane, we are committed to ensuring you get the help you need when you need it, so that you can, focus on what matters most. And our support is fast, reliable, and no matter which of Jane's plans you choose, you will have access to that unlimited human support available, to assist you every step of the way. So in addition to our dedicated support team, we also have a thriving community of peers who are ready to offer advice and answers based on their own experiences. So this is a great segue for me to invite you all to the Jane community group if you're not already there. So many folks have made the switch and have shared their experiences, where they've moved from and how they've navigated the process. The Jane community is on Facebook if you haven't seen it, and it is a great peer-to-peer learning space. You can ask about running a clinic, setup, discipline, best practice, whatever it might be. A survey on the webinar usefulness should launch shortly if you haven't already seen it. I just saw it pop up on my own screen, so please do take a chance to fill that out if you have a moment. And again, just extending a huge thank you, everyone, for joining us. And just remember that the Jane team is here, the Documo team is here to support you every step of the way. We're really looking forward to chatting more soon, and happy faxing.
Thanks, everybody.